Have you ever wondered which medical procedures doctors avoid for themselves, even though they're commonly recommended for patients? From certain tests to surgeries, there are some treatments many healthcare professionals choose to skip. Today, we're diving into the top procedures doctors think twice about and why. Let's start with routine full-body scans. While full-body CT or MRI scans are sometimes marketed as preventative health measures, many doctors avoid these unless absolutely necessary. Full-body scans often expose patients to high levels of radiation, which can be a concern over time. According to the American College of Radiology, routine full-body scans often lead to unnecessary follow-up tests due to incidental findings, which may cause more harm than good. Doctors know that sometimes less is more, especially when it comes to radiation exposure. They often prefer other, less invasive methods of monitoring health rather than going through these expensive and potentially misleading scans without a clear medical reason. Next up is elective back surgery. While back pain is one of the most common complaints among adults, many doctors, particularly orthopedic and spinal specialists, avoid back surgery unless absolutely necessary. Studies have shown that in many cases, conservative treatments like physical therapy, lifestyle modifications, and pain management can be just as effective, if not more so, than surgery for certain types of back pain. Surgeries, such as spinal fusions, carry significant risks, including infection, nerve damage, and, in some cases, worsening pain. Many healthcare providers understand these risks firsthand and know that surgery doesn't always guarantee a pain-free outcome. Instead, they often recommend non-invasive methods first and only consider surgery as a last resort. Coronary artery stents are sometimes recommended for patients with stable angina or other heart issues, but many cardiologists avoid them unless absolutely necessary. Research, such as the COURAGE trial, has shown that for patients with stable coronary artery disease, medication and lifestyle changes can be just as effective as stenting for long-term health. Doctors know that stenting can carry risks like blood clots and infection, and often recommend less invasive treatments first, such as medication to control cholesterol and blood pressure, combined with lifestyle changes. In acute cases, like heart attacks, stents can be life-saving, but for stable patients, doctors are often more cautious about recommending them. Another common procedure doctors tend to avoid for themselves is taking antibiotics for mild infections. Many doctors are acutely aware of the global issue of antibiotic resistance and understand that antibiotics are often overprescribed. For minor infections, like a mild sinus infection or bronchitis, doctors may choose supportive care and allow their immune systems to fight off the infection. The Centers for Disease Control and Prevention, CDC, stresses that overuse of antibiotics can lead to resistant bacteria, making infections harder to treat over time. Doctors know that not every infection requires antibiotics, and they are more likely to let minor infections run their course, reserving antibiotics for more serious bacterial infections. Certain cancer screenings, like prostate-specific antigen, PSA, testing for prostate cancer or mammograms for women under a certain age, are also procedures some doctors choose to avoid unless they're in a high-risk group. Research has shown that these tests can sometimes lead to overdiagnosis and overtreatment, finding slow-growing cancers that might never have impacted a person's life. Doctors are cautious about these screenings because they understand the potential for false positives, unnecessary biopsies, and treatments with their own risks and side effects. Many doctors prefer a more personalized approach to screening, taking into account individual risk factors rather than following blanket recommendations. Lastly, caesarean sections, or C-sections, are procedures that many obstetricians recommend only when absolutely necessary. While C-sections can be life-saving, they are major surgeries with risks, such as infections, longer recovery times, and potential complications in future pregnancies. Many doctors advocate for natural births whenever possible because they know the risks associated with surgery. This isn't to say C-sections should never be done, but many physicians support limiting them to cases where there is a clear medical indication. So there you have it. The medical procedures that doctors often avoid for themselves. From routine full-body scans to unnecessary antibiotics, these professionals know that sometimes less intervention is better for overall health. If you found these insights surprising or helpful, don't forget to like, subscribe, and share your thoughts in the comments. What other doctor secrets would you like to learn about? Let us